Welcome to Health Talks. I'm Gail Hogan, and today we're talking about how to prepare for colonoscopy and some common misconceptions about screening. Dr. Samuel Akinyeye is here to tell us more. Let's begin with that colonoscopy term, doctor. What does it mean?
A colonoscopy is essentially a flexible tube with a camera that we insert through your bottom that looks through your whole colon. And the purpose of this procedure when it comes to colon cancer screening is we're looking for precancerous polyps or colon cancer. We can also use it to look for any kind of abnormalities in the tissue and take biopsies or samples.
How often should people have a colonoscopy, and is age a factor in this?
Great question. Age is a factor in that. We recommend that all average risk patients to be able to get a colonoscopy at 45 years of age. Now, that's for average risk. Those that are higher risk, such as those that have a family history of colon polyps, colon cancer, genetic conditions, or if they have inflammatory bowel disease, those people should get screened earlier.
Can you explain the process a little more for some people who might have some trepidation and not really understand or be a little afraid of what that whole process is like?
Definitely. So the colonoscopy process, it starts out with the bowel prep. So about 3 days to a week prior to your procedure, you want to make sure that you're on a low residue, low fiber diet. So you want to be eating light foods, which is going to set yourself up for success later down the line when you actually do the bowel prep process. And so a day prior to the procedure, you want to make sure that you're on a clear liquid diet. And then the evening before the procedure, you're actually going to start half of the bowel prep process. It's split into 2 parts. The evening prior, you take the first half, and then 6 hours before your actual procedure, you take the other half of the bowel prep. And then the day of the procedure, you'll go into the endoscopy suite, and then you'll get checked in. They'll place an IV to be able to give you medications during the procedure, and you'll actually have the colonoscopy.
Are you awake during the procedure?
You are not awake during the procedure. We give you medications to the IV that get you sleepy and make you comfortable. So most people are asleep throughout the procedure. I even find most patients actually don't remember us doing the procedure.
And then afterwards, recovery.
In the recovery area, yeah, it'll only take maybe about 15 to 30 minutes. And so they'll be monitoring your vitals, checking to make sure you're still doing fine. And then, they ask you that you don't drink any alcohol for the rest of the day, that you don't, operate any motorized vehicles, don't make any big important decisions, but, take the rest of the day, enjoy your post-colonoscopy meal.
You mentioned working up to the colonoscopy date. You sort of start eating less and less or lighter foods, and then clear liquids and things, and then the actual prep. What's the purpose of doing all of that for you as a doctor? What do you hope to find when you then go look in the colon and you want it to be clean and clear, I guess?
Exactly. That is a great question. So this whole bowel prep process is all about clearing as much as the colon as you can, because essentially we're looking for those little polyps or these little bumps in the colon. You can imagine if you've eaten very heavy food or if you haven't cleaned out properly, there's going to be some residue, stool residue that's kind of covering those areas. And so we can potentially miss polyps. So that's why it's honestly the most important part of the colonoscopy process is making sure that you've prepped adequately. Because if you cleared everything out, I can make sure that I feel good that I've seen everything in your colon, I've removed any polyps that are there if present. And you'll feel comfortable knowing that you gave me the best possible look through your colon.
And the prep has gotten better over the years.
Yes, it has. It has. We have different formulations of prep out there. We have high volume prep, but we even have some prep that isn't as high in volume, a little lower volume that's a little bit more tolerable. We even have pill formulations of prep for some people that might not want to take the liquid formulation.
And for folks who don't want the full colonoscopy, they see these ads on TV, at-home testing, What's the difference, and why should someone look more seriously at a more invasive type of test?
It's a great question. So colonoscopy was always considered kind of the quote-unquote gold standard when it comes to colon cancer screening, but there's many different ways to get screened, and some of those home tests you speak of are like stool-based testing. And so these are great for those that are average risk. Like I said, if you have a family history of colon polyps, colon cancer, certain genetic conditions, or inflammatory bowel disease, those stool tests aren't really the best ones for you. But if you are average risk, they are great. You just want to make sure, though, if that test is positive, that you will need to get a colonoscopy to follow that up.
What are some tips to help people get through that prep process?
That's a great question. So I recommend patients to take their prep cold or chilled and then potentially use a straw. That tends to make it a lot more tolerable when you're taking the prep. If you have issues with nausea, as when you're taking the PrEP, you can consider speaking with your provider, your doctor, about maybe giving you some anti-nausea medication such as Zofran to take with the colonoscopy PrEP as well.
What are some myths that you find that you hear from folks, either, concerning colonoscopy in general, or why maybe they think they don't need one?
That's a great question. I hear too that people, the colonoscopy PrEP is it's too much. They can't do it, and so as we've talked about, it's a challenging process, but it is very doable. And so that's what I would tell people is that it's a myth that the bowel prep is terrible. It is challenging, but it is very doable. Some people also, they say that if I'm going to get colon cancer, there's nothing I can do to change that, which isn't necessarily the case. The whole reason we do the colonoscopy is because it's a preventative tool, and so we are going through that process to be able to find those polyps before they have a chance to be able to potentially grow and become cancer down the line. So I always tell patients, sometimes when we find polyps, that's honestly a good thing, because that means this test is doing what it's supposed to do.
When you do find a polyp in someone like that, do you have to maybe see them more often? When you see that patient, you think, okay, maybe there is going to be a history here, or at least we've seen something that's of concern. So once you do find polyps, then what's the future?
That's a great question. So when we do find those polyps, we remove them from the colon, and then we send it off to the pathologist. They'll look under the microscope and let us know what kind of polyp that is. Depending on what type of polyp it is, kind of portends the risk of potentially that polyp and when you should get your next colonoscopy. So there's such things such as hyperplastic polyps, which are benign polyps, and we're not necessarily concerned about those. And you might hear terms like tubulovillous adenoma or sessile serrated adenoma. Those are a little bit higher risk polyps, and if you find those, you'll likely need to be screened sooner, sometimes maybe 3 to 5 years, as opposed to if you find no polyps, it might be 10 years.
Let me go through a few myths or things that people have said. I don't have symptoms, so I don't need a colonoscopy. What do you say to them?
That is a great question. As we said before, this colonoscopy is a preventative tool. So when people, have polyps, they usually don't have symptoms. Polyps don't cause pain or bleeding for the most part. And so you might not know if there's a polyp in your colon. And so that's why it's very important that we do the colonoscopy to remove those polyps. Usually by the time you have symptoms, that polyp has potentially already progressed to colon cancer.
I could get a perforated colon, so I shouldn't do it.
That is a great question. So that is one of the risks during the colonoscopy, but it is very low. We're talking less than 0.5%. So you should feel comforted knowing that it's a very safe procedure.
And here's one that only men or people with a family history should get a colon rectal cancer screening. I didn't know that some people think only men should, but I do know about the family history. So what about both of those dynamics?
It's a great question. So men tend to have a little bit higher risk than than women when it comes to colorectal cancer, but everybody's at risk. So that's why I would say it doesn't matter who you are, everybody should get screened for colorectal cancer. Now there are some individuals that have a higher risk, as you mentioned, those that have a family history of colon cancer, if you have a family history of colon polyps, if you have certain genetic conditions that run through your family, or if you have inflammatory bowel disease. These are certain conditions that would raise your risk for colorectal cancer, and you might need to be screened earlier than average risk patients.
Is there an age where you start to say to folks, come in every 5 years, come in every 3 years, as opposed to the initial come in every 10 years once you're 40? I think that's the guideline, isn't it? Once you're 40?
Once you're 45
okay.
is the kind of this age to start screening. But I wouldn't say that we would screen more frequently at any certain age. It really depends, again, on what we find. So if we find more high-risk polyps, and then if there are a lot of those polyps, we tend to then decrease that screening interval. So we're talking about every 3 to 5 years or so, as opposed to if we're finding maybe 1 or 2 polyps or no polyps, then it's like 7 to 10 years.
Have you seen in the last 10, maybe 20 years, more and more people understanding the importance of a colonoscopy and more people doing it?
I do. I will say that I go out in the community to a lot of these community fairs, and one of the things I'm always surprised by is the amount of people that come up to our booth and are, oh, I just had my colonoscopy, or I have it scheduled in the future. And so I think we are seeing the fruits of kind of this labor of us getting out there in the community, this campaign of kind of getting out there, pushing people to get screened for colorectal cancer and emphasizing the importance of it. So thankfully we are seeing that, but there's still a lot of work to be done to make sure that everybody is being adequately screened and being followed up.
And a screening can save your life, right?
Exactly, exactly. It can very much save your life. I know a lot of people that, You know, I've seen younger patients that we've done a colonoscopy for unrelated reasons, and we found larger polyps that if they had waited until maybe their, you know, screening age, and if they had kind of discounted their symptoms, this could potentially have progressed towards colorectal cancer.
Doctor, thank you. It's been a pleasure talking with you.
Of course, thank you.
And thank you for joining us for Health Talks.